I'm Dr. Margaret Nolan, and I'm going to be talking to you today about our article recently published in Mayo Clinic Proceedings entitled An Economic Analysis of a Geographical Cohort of Hospitalized Smoking Patients. In 2012, 36.5 million people were hospitalized in the United States at an average cost of $10,400 per stay. These costs are increasing at approximately 1.9% annually, adjusted for inflation. Given that approximately 15% of adults are current cigarette smokers, by these estimates, at least 5 million patients who smoke are admitted to U.S. hospitals annually. Smoking status can significantly affect healthcare costs, so that any effects of smoking status on the cost of hospitalization could be of significant policy interest. The objective of this study was to compare the indications for hospital admission between current, former, and never smokers, and compare their costs per hospital admission. We hypothesized that the cost per hospital admission would be greater in smokers compared with past and never smokers. The design of this study was a retrospective, nested cohort design with cohort membership determined by cigarette smoking status, either current, former, or never smoker. Propensity score techniques were used to control for differences between groups other than smoking status. Participants were admitted to the Mayo Clinic Hospital in Rochester, Minnesota between May 5, 2012 and August 10, 2014, and they lived in areas covered by postal codes included in Olmsted County, Minnesota. What we found, illustrated here in Figure 1, was that compared with never smokers, a significantly greater proportion of admissions in current smokers were for respiratory, circulatory, and infectious causes, as well as mental illness and injury or poisoning. As shown here in Figure 2, 3 of these indications were also more common in current compared to former smokers. The average cost per admission, without regard to admission indication, did not depend upon smoking status. In fact, there were no significant differences in costs between current and never smokers, but costs in current smokers were actually significantly less than in former smokers, by about $870 per admission. So in conclusion, there's no evidence that the cost of a hospital admission is greater in current smokers compared with never or former smokers, even when controlling for admission indication. This was in a generalized population of medical and surgical patients. In fact, former smokers tend to have the highest admission costs compared to never and current smokers. Perhaps this reflects the severity of the smoking-related disease that caused them to quit in the first place. Thank you for your interest, and I hope you enjoy reading our article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.